Hello, my name is Suzanne Rastrick. I'm the Chief Allied Health Professions Officer for England, and I'm really delighted to be here as part of your strategy launch, but at this event focusing specifically on outcome measures. And I wanted to start at the beginning to say that we've been really grateful over the last 7 years of my tenure to be well supported by the Royal College in this work, and particularly the relationship that I've enjoyed with Emeritus Professor Pam Enderby, and I'm grateful for her leadership internationally in the work to develop the therapy outcome measures. But I specifically wanted to focus on England from my part this afternoon, and actually really focus on some work again that the Royal College have supported us with. We hosted a webinar last year led by my colleague Caroline Poole, who is a member of the Royal College and a quality improvement expert, but you'll see here that Catherine Moyes also joined us, as well as a number of other colleagues, and Christina Serrault, who is one of our lived experience ambassadors. And the focus of that was really to think about what was it on an England to come basis that we needed to do and think about right now. And a couple of the thoughts that arose. This first one is really around the need for an evidence base, and you'll see here that clearly over the last 20 years many of our services have failed to deliver routine outcome measurements in practice, and that the conclusion was that appropriate action was needed at individual, team and organisational levels. Really thought from Christina, as one of the people who uses our services, was that quite often a good process does not necessarily provide good experience for people, their families or staff. And actually also that sometimes we focus on operational matters at the expense of underperformance in actually transforming people's lives. And how do we understand that? I'm really grateful again to the Royal College for the work and leadership that you've had in forming and really being very formative in the development of the AHP Outcome Measures UK Working Group, which formed in 2017 and then in 2019 published a checklist for AHPs across the UK, really thinking about discriminating and deciding which outcome measures would actually suit. And this was really led by one of the impacts, the fourth impact in our previous strategy, AHPs into Action, which really talked about the need for critically evaluating what we do and actually understanding that better, but underpinned by informatics and digital initiatives. So in terms of the output from the webinar last year, there was really this based on Plan, Do, Study, Act cycle as a framework for action, really thinking about what is it we can do to be clear about what is it we're trying to measure, what do we think would really deliver the value that we're seeking, testing out those measures, and then reflecting and learning, adopting, adapting or abandoning, really to decide on what is going to add value in this context. So those were some thoughts from the webinar, which I think are very pertinent and helpful. But also I just wanted to leave you with my final thought, which is really from an English perspective, we're looking at this quality dashboard and how we optimise the workforce to really underpin the quality of services that we deliver to people and their families and communities. And you'll see in that purple section, that's really where outcomes fit in terms of delivering quality care and actually assessing and understanding that. But the other parts of this paradigm, the optimising the workforce, improving productivity and supporting staff, are all part of the equation. And so strategically, I want to be clear that in England, these four domains are the things for me that really underpin the impact of us to be able to deliver and understand quality outcomes.